So I actually used the consult line just last week. And, while the REACH training and, my 12 years in primary care pediatrics as a physician have given me a lot of tools, I had a patient who I was just over my head. And before the consult line would have been available to me, I would have had to send this child to the ER. So to let you know a little bit about this kid and family, this is a child who's been in and out of the psychiatric hospitals 6 times in the last 2 years. Most recently, I am in Roanoke, Virginia. He was admitted to a hospital at Virginia Beach. So 3 weeks ago, this child was discharged to home from Virginia Beach. Their first psychiatrist appointment, because they don't have a local one, he's been in the hospital so much, isn't until 2 weeks from today. He was on 5 medications and hallucinating. He was safe at home, wasn't suicidal, so did not have a reason to be admitted to the hospital again. I was able to call the consult line within an hour, talk to a psychiatrist, and I had a treatment plan. And I called the kid's mom back. She was on her way home because she lives an hour from me in a rural area of the state. And we established a treatment plan, and I'm going to see them back later this week. And that is care that I could not have provided without the consult line. I would have been over my head. I wouldn't have known what to do. Also thinking about what is VMAP doing for us in primary care. There is a real burnout that I've seen happen, I see happen with my colleagues in primary care, where we feel like we know we need to address a need and we may not know how to.
I've been so thankful that VMAP has been there doing the consultation lines. They are responsive very quickly. I get phenomenal advice. I am much more comfortable. I feel like my patients get so much better care by getting advice from VMAP than if I had referred them to a general psychiatrist, somewhere within an hour from here. And I feel my patients are much better cared for. And when I need to get help and do a referral, I still have trouble finding somebody to do a referral with, but I feel like the patient's under good management until that can happen.
Especially when it comes to any need for medication, there is just such a long wait, issues with insurance and so on. And so I just felt like my hands were tied. Now, with VMAP, I feel like I have been able to bridge that gap. And that, has been really, really meaningful. Being able to have, more of an education and background in how to manage these medications. And then when we are limited still in our knowledge set, to be able to call the psychiatrist and get, that feedback to intervene has been just a huge, huge lifeline to basically bridge that gap. These families would be just waiting for months and months without any help otherwise.
So luckily, the VMAP program was there. One of the prongs of the VMAP program is education. And through the education prong, I've been learning a lot about how to screen for depression and anxiety in adolescents and how to manage it and treat it.
I remember my very first mental health patient that I took care of as an attending. And this patient came to me in a checkup, and she was severely depressed, getting to the point of being suicidal. And I knew that I needed to do something now to help her. So I walked out of the room and went over to one of my colleagues who I know does a lot of mental health and has prescribed a lot of medication. And I was like, I need help. And they handed me all of these different tools that I could give this patient, walked me through some basics about how to start the medication. And I did all of those things. And I felt, wow, I think I just really helped this patient and made a big difference. I don't feel comfortable doing this at all on my own, but it's here and I'm going to have to do this to be able to take care of my patients. So I was very fortunate to be given the opportunity to participate in the REACH conference within a few months of being an attending. And it was offered free of charge for many of the people that are in my local community. Several people from the practice where I was working, we all went together, and it was the most impactful CME course I have ever had. I walked out of those 3 days and transformed my entire practice. I started screening more readily for mental health concerns at every single checkup. I felt more comfortable evaluating patients and diagnosing them with things outside of just ADHD, but really getting into more anxiety and depression. I started doing a lot more medication, getting a lot more comfortable with all of that. And now I can definitely say that mental health is a very large part of my practice. And I see patients every day, treat patients every day. And VMAP has been extra helpful at this point because I feel quite comfortable with a lot of the kind of straightforward issues. But then when it gets a little bit more complicated, it's amazing to be able to pick up the phone and get in contact with a psychiatrist and get advice that then I can use not only for that patient, but for when I move forward and take care of other patients.
About a year and a half ago, I did my first conference with Project Echo, the year-long group. And so I just completed that, I want to say August of this year. And after that, immediately signed up to do the deeper dive for the younger kids between 0 and 5. And then was connected to the REACH conference as well, which myself and one of the physicians at our practice just completed. And so I feel like I've learned a ton. I feel like my skills have grown because of that. It was great to hear from not only psychiatrists, but also from pediatricians. I feel that my understanding of a lot of these conditions, ranging from depression to bipolar disorder, has grown, and I know that my comfort level with more complex conditions has grown. And then more recently, I've been able to also use the VMAP line for one of my patients that unfortunately is unable to follow through with psychiatry appointments. And so we have been managing his condition, and I feel like he's tried more medicines than any of my other patients. And I was able to reach out to a psychiatrist through VMAP, and they called me back in like 5 minutes and gave me some recommendations for what to do when he comes in next.